Now, in your testimony, Dr. Collins, you talked about NIH's efforts to partner with the private sector to develop so-called adaptive master protocols for clinical trials. Are we doing something novel here, or are we doing it exactly the same way we've always done it?
We're doing something very novel, and I appreciate you raising all of the background here about how we got here. And Senator, your role in getting BARDA to where it is right now has just been critical for where we are with Operation Warp Speed and having that capability of moving quickly and doing things in a very business-friendly way to try to get the tools that we need in place. But another thing that I had the privilege of helping make happen back in late March and April was to go to all the pharmaceutical companies that we knew had things they could offer here, both in therapeutics and in vaccines, and saying, instead of all going off in our own directions, let's see if we could do something together. And out of that came this partnership called ACTIVE, which stands for Accelerating COVID-19 Therapeutic Interventions and Vaccines. That group rolled up their sleeves 24/7, 100 people, mostly high-ranking scientists in both public and private sector, designed these master protocols to be able to launch clinical trials without the long process that it often takes to decide about the nitty-gritty of protocol details. And out of that have come a whole series of trials on monoclonal antibodies, on anticoagulants, on immunomodulators, and all of that, I think, has gotten us much further than we would have been if we hadn't decided, let's do it differently this time. Let's really get everybody around the same table.
All driven by the scientific community.
Absolutely, from both sectors.
But you had the latitude in statute to do that.
We did, and it helped a lot that nobody was feeling like, oh my gosh, we've got to do 6 months of legal consultation, because we already had the framework to see how we could do it.
So I think the takeaway from today is we actually see the U.S. government functioning. We see the process of development, partnership with the private sector in coordination with the government actually working. We haven't changed the rules. We haven't changed the protocols. We've exercised the latitude that was there in statute for an incident just like this.